I'd like to note that there's a good reason for SITE presenting today's event jointly with Accountability Lab. Over the last 6 years, our two organizations have worked together, formally and informally, in countries ranging from Nepal and Pakistan to Liberia. As their name implies, Accountability Lab is a place where innovation occurs, where novel approaches to anti-corruption are cooked up and served in some of the most highly corrupt countries in the world. SIPE's cooperation with Blair Glencore's Accountability Lab has served us well, as Blair's guidance has been instrumental to the success of SIPE's Anti-Corruption and Governance Center. With that, I'm not going to speak much longer. I'd rather turn it over to Blair, who's located in Islamabad, to give us some context for today's event on South Asia. Blair, over to you.
Thanks so much, Andrew, and thanks to SIPE for co-hosting this, and to the Anti-Corruption and Governance Center. It's great to be here, calling in from Islamabad. As I'm talking, you may, for those of you listening and watching, see a poll pop up on your screen asking you about your feelings about corruption and the COVID-19 response in South Asia. Please do feel free to fill that in. We're trying to get a sense of how you feel about all of this. And so while you're filling that in, let me give you a couple of thoughts from here on all of this. And I think the first is, as I'm sure many of you understand, given that you're tuning in, that the coronavirus, I think, is not just a healthcare crisis. It's an accountability crisis, and it's a corruption crisis that was caused as much by corruption as it was by the virus itself. I think during this webinar, we're going to talk more about perhaps how corruption is happening in the response. But it's corruption that's gutted healthcare systems in South Asia, which has made it so difficult for countries in South Asia and elsewhere to deal with this. In Pakistan here, for example, just last year, before all of this started, towards the end of last year, the Medical and Dental Council, the main registration body for medical bodies, organizations, was dissolved and taken over by the police at one point to try and fight corruption. In Nepal, I've heard all sorts of stories about medical schools bribing officials to stay open, even hiring fake patients and temporary faculty to pass medical inspections. So it's clear that there were massive issues of corruption within healthcare, of course, in South Asia, even before this. And this is a key cause of a lot of the challenges we're seeing now. The second point, I think, is talking about Pakistan and Nepal in particular, given that those are the places that our teams are working in South Asia. There are sadly recent experiences with disasters, the earthquakes in Nepal, for example, and in Pakistan recently, and I'm not sure that the governments are learning the lessons from those disasters for this crisis. I think we'll hear more about this from our panelists, but corruption has always been something that's undermined the response of governments in South Asia to crises and disasters, and I'm not sure they've thought enough about how to deal with issues like contracting, the independence of oversight bodies, the importance of citizen monitoring, and feedback on the response, and how they could rectify some of the mistakes that have been made in the past from these other disasters. And then finally, with South Asia, I think what all of this does is undermine trust in governments at a time when this is needed most, of course, to deal with the crisis. There was a survey in Nepal last year that indicated that less than 5% of people were satisfied with the government's performance. There's a little bit of feedback there. I hope you can still hear me. So trust in Nepal in government was very low anyway, and this is of course only going to make things even worse if they deal with this pandemic in a way that is unaccountable and untransparent. In Pakistan, we've seen the lack of trust undermining the response of the federal government, and provincial and local governments begin to take their own action to try and respond to some of the challenges, because collective action on a larger level simply hasn't been possible. But having said all of that, I think there are some incredible people within governments across South Asia doing absolutely amazing things. We call them integrity icons at the Accountability Lab. Whether they're in healthcare or procurement or education, really, going above and beyond to find solutions. And there also, of course, are many incredible civil society organizations who are responding to this call, who are challenging governments to be more accountable, who are stepping up and pushing back against corruption. Some of whom we're going to hear from today. So I won't talk any further, and we'll get right into that. But to begin with, I wanted to introduce Dr. Ali Riaz, the distinguished professor at the Department of Politics and Government at Illinois State University, and a well-known expert on South Asia, who I think is also going to help us set the scene a bit. Thank you, Dr. Riaz.
Let me try to give an overview of the situation. First of all, we know not only in South Asia, in any kind of global health emergencies, there is a possibility or likelihood which triggers corruption. Huge range of corruption that we have seen. We have seen in case of Ebola crisis. We have seen in case of others, even in regional or even in case of the different countries when there are disasters. Particularly when there is a health crisis, we tend to see these things. In case of South Asia, there are three things that we need to take into account. The first thing is the situation that we are witnessing throughout the whole region is the glaring gap in public health preparedness. And that has to do with two reasons. One, of course, definitely, is the low investment over the years, over the decades rather. There have been very few countries which we can say that have made substantial investment in public healthcare infrastructure, hospitals, public clinics, doctors, nurses, and those kind of things. But the second thing is the corruption. In large measure, we have seen that the corruption, whatever amount has been invested into, there has been pilferage, there has been abuse, misuse, and malpractice. All these things have taken away the resources that was badly needed to create this infrastructure, serve the public. The second, we need to take into account that the corruption is endemic in South Asia. I mean, if you look at the TI, Transparency International Corruption Perception Index, take, for example, Bangladesh, which ranked 146 out of 180 countries, or for that matter, Pakistan, which was 120, or even India, which is 80. So the endemic corruption in all sectors have been an issue and continue to be an issue in this instance as well. The third thing, which we have already heard, thanks to for bringing that up, weak institutional structure and lack of trust. Across South Asia, all the governments has this problem that they do not have the trust of the public. That's why from the information that is being provided with respect to the extent, nature of this crisis, this catastrophe, to the steps they are taking. So now, with those kind of in the context, let us look at what are witnessing already in the field of the corruption. First one is the immediate and most importantly is the distribution network, the basic necessities such as food, which needs to reach out to everybody. And in this case, what happened, we have seen that there are targeted social protection schemes, but there is a considerable leakage. We have seen in case of Bangladesh, the food, the rice has been stolen by the people who are connected to mostly the ruling party and the government. We have seen this in Nepal. And of course, in case of India as well, the PDS, the public distribution system, which was smaller, it has been expanded. But there are instances where we have seen that people who needs to be getting into this PDS system are not exactly getting into, or in some cases being asked to pay bribe to the local officials, police, and so on and so forth. This is the first thing the distribution network needs to look into. The second one, is the procurement. One of the major problems is at this point, given the lack of preparedness, not only in South Asia, not only in Bangladesh, Pakistan, India, Nepal, we have seen it in the West as well, in the United States and other cases, but the procurement of medical supplies have been an issue. And this we have seen in case of Bangladesh, where the subpar N95 mask have been distributed and bought by the government. Later, they retracted it's a mistake. We have seen the same thing in case of Nepal. The Omni group that came up that we have seen how this mask and PPEs were actually not to the standard, and then government had to cancel that one. We have seen in case of India, the COVID test kit that was brought from China, and we have seen that the government was selling at a higher price, and that created a case which basically the courts, without the court's intervention, we would have seen this continued corruption. So this is the second element, that's the procurement of medical supplies. Third, which is the bigger picture, the stimulus. What we have seen in case of stimulus, all these countries, there have been stimulus packages, but who it is reaching to has become an issue. In many instances, the cash transfer program has been, for example, in case of Pakistan, but is it reaching to the people that it needs to reach? Say, for example, in case of Pakistan, the cash transfer has included 12 million people, right? And many still are left behind because they're not in the list or they're not reaching out, being reached out by the government. We have seen how this stimulus package has been, shaped, which favors a certain group of people or the bigger companies rather than the small and medium-sized enterprises. This became a major one in terms of what is being allocated, who it is being allocated, how it is being observed, how it is being monitored. Those are the issues that is endemic throughout the whole South Asia that we are witnessing. In some cases, it is equally true to other countries, but given that we are focusing on South Asia, we need to keep in mind that this is what is being happening with respect to the stimulus packages. And then we have seen this petty crime sort of thing. At the very lower level that we have seen. For example, in case of Pakistan, what we see that people from Iran, in many instances, as being reported in press, are bribing the border guards and slipping into Pakistan. Iran has been badly affected by this virus, and yet people are being just walking into this kind of things. Manipulation of food prices, which is same in case of Nepal. We have seen that one is being reported. We are seeing that in case of Bangladesh. On the one hand, that the farmers who have grown vegetables, those things they're throwing away. The dairy products they're throwing away. Yet there's no channel to bring those to the cities or the places that it could be sold. On the other hand, there's a price gouging throughout the whole continent, throughout the whole South Asia that we are witnessing. These are the elements that we have seen. These are the elements that we are witnessing. But what needs to be done at this point? The first thing that I would say that one major leverage that the donors have currently, all these countries are asking money from IMF, the World Bank, and other organizations. These organizations, the donors, should be very much careful about the transparency. They should work with the possibly or likelihood of stealing public resources needs to be stopped. And this is an important element. They need to work with the practices that would ensure not only transparency but accountability from the government. That's why they need to work with the independent monitors. Traditional anti-corruption policies, mechanisms that are in place, in many cases, given the emergency, given the urgency, that those will be subverted, some way skipped, but that needs to be insisted those are followed, and also additional monitoring processes should be in place. Funds should be channeled through those which have high anti-corruption best practices. The second thing is the protecting the whistleblowers. What we are witnessing that in many cases, Bangladesh, India, in case of Nepal as well, in case of Pakistan, the doctors and those who are doing the whistleblowing are being persecuted. That needs to be stopped. These are the two things. And finally, what I would underscore is the distribution network and overseeing this distribution network independently involving civil society and non-governmental organizations. In many cases, what we have seen is the absence of the private sector's involvement, absence of the NGOs in this. Private sector in this case, unfortunately, is not stepping up, and the role that they should have taken, they're not taking that role, especially in terms of providing the medical support and services. In case of Bangladesh, the private hospitals have not served well. They have actually turned away the patients of various kinds, including COVID-19. Those are the things the private sector needs to step up And that can be done only if there are monitoring from the non-governmental organizations, civil society, the government, and the private sector. So I will stop there and hopefully in another opportunity to respond to some of the questions if there is. Thank you.
Thank you, Dr. Riaz. That was very, very helpful and a wonderful introduction to the overall regional focus of this event, which is South Asia, of course. I wanted to remind folks that this session is being recorded. Everybody got a written notification of that, but wanted to remind you of that. And also to let you know that during the Q&A period, which will start in about 25 minutes or so, we'll be taking questions through the chat function. So if you have questions that occur to you as you listen to the speakers, please feel free to weigh in using the chat function. So now I'd like to introduce the director of the Accountability Lab operation in Pakistan, Fayaz Yaseen, who will speak for about 10 minutes. Fayaz?
Thank you, Frank. Thank you, Saib, for extending this opportunity to us. Thank you, Blair and Dr. Ali Riaz, for setting the tone of the event. Very right. And thank you, Dr. Ali Riaz, particularly because we have already touched upon a lot of issues through, a lot of issues and ways through which corruption has already started seeping into the government's response to this pandemic here in Pakistan as well. As I speak, with the audience here, the total number of coronavirus infected people, it has already crossed 15,000. As compared to other countries globally, the number looks very low, but we have only we have only today been able to know that since April 24th, the government has systematically decreased the number of testing per day, which is sort of an artificial sort of way of flattening the curve of COVID-19 here in Pakistan. Having said that, so far as soon the coronavirus pandemic, it erupted in China, which is in our neighbor, and eventually soon after in Iran as well. These were two of the hot spots in the region. Pakistan was sort of we anticipated that soon it'll be here in Pakistan as well, although it took some time before it went to other countries first, and only afterwards it came back to Pakistan. As Blair said, this pandemic is caused by corruption as much as by the virus, and this is very true, particularly in case of Pakistan, because the government of Pakistan, when it knew that it is spreading by humans, the government closed down our borders, both with China and Iran, and it started monitoring of the people who are coming in from other countries. However, corruption was the reason why the disease was able to spread in Pakistan. For example, people were able to bribe their way out on Iran border. There were official medical checkpoints which were checking people for COVID-19 symptoms, but those people paid bribes. Same thing happened on the airports. And as disease spread, the government, it came up with one of the largest relief package in the history of the country. It started distributing 12,000 rupees each to target about 12 million deserving families across the country, as Dr. Ali Riaz also highlighted. It closed borders, with China, Iran, and started monitoring the international airports. It imposed, lockdowns across the country. The federal government was initially hesitant, but the provincial government, put their step down, and Sindh was the first one to do it, followed by Punjab and other sort of provinces. All the businesses were locked down: shops, schools, public transportations, wherever the government sort of could handle it. And as Dr. Riaz has said, that Pakistan is one of those countries where the health infrastructure is very poor. For a population of about 220 million people, we only had about 1,700 ventilators across the country. And then whatever money has been spent so far, there has been issues of of corruption, reported corruption. And then out of that mega package, which relief package, which the government has taken out, apart from that, massive amounts of money, like billions of rupees, they are being dedicated to procuring medical relief, medical equipment. And then since it's a kind of emergency purchase, there are no rules and regulations and one of the military's institution is in charge of spending and that money and procuring the medical goods. It's very hard for the media and civil society organizations to sort of follow the money, the kind of rates on which these goods are being purchased, the quality of these goods. The Sindh government has already sort of raised this issue that the quality of medical equipment that is being provided and that is being imported from China, the quality is not very good. The testing kits in many cases, they are not very reliable, and that is the situation we are facing here in Pakistan. I have touched upon on corruption, the way people were able to sort of pay bribes at the borders. But then when lockdowns were imposed and the businesses were closed, the factory owners were mill owners were, they were very resistant and very hesitant in closing down their businesses. They started paying out bribes to the police official, that they would report to the government that these factories are closed, but in fact they were in reality they were functional, very much functional and very much open. People during the lockdown, they continued to roam on the roads, and they were able to sort of make their way by bribing the police, by bribing the police. And then initially when quarantine centers were set up, in Sindh province and other areas as well, people sitting in those quarantines, they were able to bribe the medical, people who were sort of monitoring their health to bribe their way out and to go back to their homes. Yeah, can we move on to the next slide, please? These have been the cases, which we have reported here in Pakistan. With regard to the solutions that not only just the Accountability Lab has been proposing, but other organizations globally they have been proposing as well, because the general nature of response and the general nature of measures taken by the governments worldwide, they are similar, and the sort of universal way of kind of siphoning the relevant money is they are more or less the similar. In this regard, the first emphasis which Accountability Lab has been laying is on transparency. The government needs to introduce practices such as open contracting, fiscal openness, and as Dr. Ali Riaz suggested, protection for whistleblowers. In Pakistani law, the funds which are spent under the emergency situations, one cannot take details about that. The detailed breakdown of those expenditures through the right to information requests. They are sort of blocked allocations and blocked allocations which are made in emergency situations. Details against them, they cannot be requested. I think that needs to be addressed. To restore the trust of people on the government. Then practices like artificially flattening the curve by reducing the number of tests, which is currently being reported in Pakistan. When the governments sort of get into this kind of practices, this is where the trust between governments and the citizens and the international community is sapped. In Pakistan's case, we already have a very good national database registry which is called NADRA. It has a very detailed sort of data of socioeconomic statuses of people across the country. The government claims that it has been using NADRA's data to sort of verify and make those cash distributions, but there have been instances in Sindh and parts of Punjab where these monies have been embezzled. Those poor, they were required to pay a part of that money upfront to the people who were responsible for distributing that money. So while NADRA's data is being used, technology can still be introduced to ensure that either these are this money is given through bank transfers. Those people can be asked to open up their bank account for free in a day, or through other means of technologies by monitoring or installing cameras. It can be ensured that small amount of money, it's not being taken away from the people who are affected. Lastly, the police bribe issues, which are very common. I think this is where citizen journalism and sort of work of civil society needs to be brought in. The watchdogs and citizens, they should be allowed to sort of not only monitor and report the situation, but also capture it on camera. Currently, we don't have a law, but the police authorities prohibit people to sort of video record police dealing with the citizens, with the common people. But those people who have secretly been able to do that, they have sort of unearthed a lot of scams. How police is sort of forcing people to bribe them whenever they try to be out on the road, even if they are out there to sort of buy groceries or daily essential necessities of life, or those sort of things. Thank you. This is from my side, and happy to answer if you have any questions.
Yes, thank you very much. And as a reminder, if you do have questions, please submit them in the chat box, the chat section, and then during the Q&A, we will turn to them. I'd like now to introduce Aiman Rasheed, who's the Acting Executive Director of Transparency in the Maldives. I had the pleasure of meeting him last year. They're a strong site partner. Aiman, you're up.
Thank you, Frank. I'm waiting for my slide to come up, but yeah. So can I get the first slide, please?
That's the slide you're looking for, Aiman, or no?
No, the slide with the photo on it, the photo of the capital. So yes, so you're looking at the capital of the Maldives. So that's the most populous island in the Maldives. I wanted to point out two things with this photo. So if you look at the photo, the buildings you see. So this is one of the most congested cities in the world, and if not the most congested city in the world. We have, so the longest road on this capital is 1.7 kilometers, but it houses about 40% of the whole population of the country. And it also houses a huge migrant worker population who live in slum conditions. What that means is the congested nature of the capital makes it very vulnerable to the spread of the COVID-19 virus. So this is the capital of the Maldives. Also, you will notice that the island is completely flat, and it's extremely vulnerable to climate change, which is a completely different story. But the main point here is that the Maldives is very vulnerable to the spread of the COVID-19 virus, primarily because the capital houses so many people and because it's so congested, and that there is a huge population of migrant workers who live in slum conditions. And what that means is, because they live so close together, one of the main things that we're seeing is the spread of COVID-19 virus among vulnerable groups such as migrant workers. So that is one of the main things that I want to show you, because the Maldives, it's very hard to understand how Maldives, what Maldives is without actually seeing it. So to give you an idea of the issue of corruption in the Maldives has ranked among one of the countries that ranks among the worst in the CPI. When you think about countries like Bangladesh, Pakistan, India, many people think of these countries as very corrupt countries, but very few people actually know Maldives ranks lower than India, Pakistan, Bhutan, Sri Lanka in the CPI. The only country that ranks worse than the Maldives in the CPI is Bangladesh. So when you look at the data, the Maldives is a very corrupt country. And it's not, the type of corruption in the Maldives is quite different to the type of corruption you'll find in countries such as India, Pakistan, and Sri Lanka, neighbors in the region. My main point being that the type of corruption in the Maldives is petty corruption. It's not petty corruption as opposed to many other countries. The prevalent type of corruption in the Maldives is grand corruption. There's a lot of research, the Global Corruption Barometer, well use of democracy survey, and a variety of other studies done by Transparency Maldives as well, that show that the type of corruption in the Maldives is the type of corruption that connects the judiciary, the parliament, the executive, and the big businesses in the country. And what that means is when the economy is at a standstill, when there's a crisis, the type of corruption really has an impact on how much money is being lost in the economy. The Financial Secrecy Index 2020 of 133 countries, 133 jurisdictions that were surveyed, Maldives was ranked as the most secretive jurisdiction amongst the 133 jurisdictions that were surveyed. And what that means is the country is possibly a hub for money laundering. And the World Bank country opinion survey of 2018, the survey showed that anti-corruption is the second most important development priority in the Maldives. And lack of government capacity is cited as one of the top reasons for reform failure. The first reason is corruption. So this is a sort of a snapshot of the Maldives and why it's so vulnerable to corruption, and both corruption and COVID-19 pandemic. So the World Bank recently, 1.5 months ago, put out an analysis report, and one of the main findings of the report is that they estimate the Maldives would be the country that is the worst hit economically due to the COVID-19 pandemic. This is primarily because 70% of the Maldives' gross domestic product is either directly or indirectly tied to tourism. And tourism is at a standstill. There are no tourists arriving to the Maldives. And this has been the case for 1.5 months. What that means is the government, at a time that the government needs to spend more, it is not earning any money at all. So the industries in the Maldives are at a standstill. And this has huge implications on the government's ability to effectively counter the pandemic and to effectively manage the economy and to effectively respond to the crisis. So the Maldives Monetary Authority, the Maldives Central Bank, in the worst case scenario, they expect the Maldives' economy to shrink by as much as 19%. And the accountability institutions are largely dysfunctional. For example, the Anti-Corruption Commission, the Auditor General's Office, and the Information Commissioner's Office remain closed. And because they remain closed, what that means is corruption in procurement, corruption in medical supplies, and basic services that the government needs to provide to the people. When there are issues, it's very, very difficult for people to access accountability systems. And lack of transparency, sometimes as a result of lack of capacity of state institutions, is a huge problem. Even before the COVID-19 crisis, the Maldives had many issues, and issues around lack of transparency, institutional capacity, as well as the secretive institutional practices that have been part and parcel of governance in the country, still remain in effect. Maldives had its first multi-party democratic elections in 2008. Prior to that, the Maldives was ruled by a dictator of 30 years, and the transition to democracy hasn't exactly been smooth. It's been a bumpy ride. And what that means is the Maldives has not had the opportunity to institutionalize good governance practices. And that is being made very apparent in the COVID-19 pandemic. The inability of the government to adequately respond to the crisis is partly because of weak institutions as much as it is an issue of corruption. Can I have the next slide, please? Other issues that I wanted to highlight are the Maldives has a large migrant worker population. There are estimates that go as high as 60–70% of the migrant worker population, amounting to about 60–70% of the resident Maldivian population. And what that means is the migrant workers remain vulnerable. The Maldives is ranked a tier 2 country in the U.S. State Department's human trafficking report. So this specific group remain very vulnerable to COVID-19. And because all of the resorts have shut down, this means a lot of the workers, especially daily wage workers, have lost their main means of income. So that the economic disparity and the economic impact of COVID-19 is profoundly felt in many sectors of the country, especially because tourism plays such a huge role in the country. And we've had issues with the opposition using misinformation to create unrest. Yes, the government's response is inadequate, but it doesn't help that the opposition is using any basically any tool in their arsenal to undermine the government at this critical time. Yes, the government is ineffective, but the tools that the opposition are using are in fact having a much more negative impact rather than using existing systems such as the parliament and the accountability institutions to hold the government to account. And unfortunately, the Maldives has also seen violent extremism sort of crop up during the crisis. We've had a number of attacks by one specific attack and one suspected attack on public infrastructure and private property during the COVID-19 crisis. So these are some of the issues that I want to talk about, and I'm happy to respond to any questions you might have.
We're going to move on now to the view from Nepal with Ashmita Sharma. And I wanted to remind everybody on the call on this presentation that if you have questions, we've gotten a couple already, put them in the chat box and we'll read them out during the Q&A session. And wanted also to make a quick plug for those of you who are interested generally in this topic of COVID-19 and corruption. We have a WhatsApp channel for practitioners, for anti-corruption practitioners, and we are happy to sign you up to it. Send us a message in the chat function or else an email to acgc@sipe.org. That's acgc@sipe.org. If you'd like to be, if everybody could mute themselves, I'll ask just Ashmita to unmute herself and we'll hear the view from Nepal. Thank you.
Thanks, Frank. So as Blair has already talked a little bit about earthquakes, so I want to start something about that. So this is not the first time that Nepal is actually facing this kind of emergencies. In 2015, we had faced a devastating earthquake who killed around 9,000 people and left 25,000 injured. And the multiple dimension of crisis was created, constitution was drafted to a fast track process. But it did not consider the interests of many people, people from Madhesi and then minorities and human. And also in 2015, blockade was imposed by India. So all made 2015 a significant year in the history of our country, which also left behind long-term impact on economy. And actually the crisis don't announce their arrival and failure to assess the warning sign right now will certainly bring horrible consequences. So when Nepal, before Nepal had plenty of time to prepare for a possible effect and take a necessary action when China was struggling with coronavirus outbreak. So I want to share you one of the example of government inaction. So during the coronavirus, for 3 months, the corona testing capacity in Nepal was limited to only one hospital. And this crisis also however going to affect actually the two major pillars of Nepalese economic. One is remittance, which contribute to 29% of GDP, and tourism sector, which contributes 7.9% to GDP. So therefore, in coming days in Nepal, we could see a huge influx of migrant workers from Middle East, and also drying up of 100 million jobs that has been provided by tourism sector. like recently, World Bank also estimated that Nepal's economic growth rate will remain between 1.5 to 2.8 in 2020, which is much lower than the government's initial estimate of 8.5%. This could also mean a significant portion of population who will be pushed back into, poverty the way this earthquake did in 2015. It is also estimated, the World Bank also estimated that 31.2% of population is high risk of falling under extreme poverty with COVID-19 in Nepal, actually. So beside, like all those things, like when the active cases were found in Nepal, the Nepal government actually, implemented two mechanisms under the leadership of Deputy Prime Minister. One was like forming the High Committee for Coronavirus Prevention and Treatment. And another was like Corona Crisis and Management Center. So the Corona Crisis and Management Center coordinated everything actually regarding the COVID-19 at all the level, which include like committee members, politicians, government officials, and health worker. Nepal government also implemented one window relief distribution mechanism and also decided to, bear the entire cost of the treatment for corona infected people. And government is also trying to be as transparent as they can. So they regularly nowadays, like they have been regularly publishing the data related to tests and also the details of budget, expenses, and policies. And also the one thing that government, I really liked about government was, to motivate like citizens, what they did was like they decided to provide like actually 75% of salary as an incentive for all the government officials who are working for coronavirus prevention and control. Not only that, like when cases were started to seen in Nepal, government also like created 60 strategy to cope with coronavirus. Like one was like travel restriction, closing all the entry points of arrival in Nepal from abroad, and even lockdown within the countries. Now is like more than a month that we have been, the country is locked down. And the next one is like testing, from the beginning now there are like more than 15 testing places where we can test corona. And even like tracking and tracing, identify the potential infant and then tracking their movement, and also like treatment. And together everyone is like from all the level including government, CSOs, private sector are coming together to fight against coronavirus. Now talking about like a little bit about the corruption that during this response that we have seen. Like in any disaster, Nepal was never ready for any kind of emergency. Nepal always lacks like proper coordination, preparation, planning, and mechanism. One of the examples that government lacks proactiveness is when WHO declared the crisis of global pandemic. Our government was actually busy claiming Nepal a coronavirus-free country. At the beginning, they didn't take it seriously. When Nepal had its first case, the country lacked adequate resources for medical workers, and even there were only a few hundreds coronavirus testing kits. And even there were like people also like had lack of appropriate information on the protocol about quarantine, self-quarantine, isolation, and treatment. So this has also been mentioned before, like although like it's actively being investigated, however, government procurement is highly criticized. Selected companies couldn't provide service on time, nor the selected product have good qualities. Recently, Nepal Ministry of Health and Population has cancelled the contract with Omni Business Corporate International after 75,000 rapid testing was brought to Nepal and which was about to use by hospital. The most interesting thing is like the price of few of the items were raised up to 500%. And the government decisions like usually are like seen unplanned. They sometimes like, they make a 1 hour, in 1 hour they decide and then another hour they canceled the decision. Most recently, in 1 hour they decided that like they were about to let people to go to the village from the cities, and within an hour they canceled the decision. And one day the government said that they will purchase the materials with companies. The second day they purchase from government agencies. The third day they decide the army will take over the procurement. Even in relief aid also, distribution also, we have seen lots of mismanagement issues. People who have the network has access to the support. I think government is now, trying to take this pandemic situation as an golden opportunity to centralize the power by not listening to opposition, by passing opposition, parliamentarian, and constitution. Most recently, just like a few days back, Prime Minister brought 2 ordinances related to Political Party Act, which was to allow leaders of political parties to split their parties with the support of either 40% of members of the central communities or the parties lawmakers in the parliamentarian. Which couldn't happen, but because of like majority of people were protesting against, they had to withdraw that ordinance. And the other ordinance that the prime minister made was to scrap the opposition leaders participating in making constitutional appointments. This is clearly against the spirit of constitution. And government plan was also to recruit somebody at who can close all the corruption cases which is under investigation, such as the corruption allegation of Omni Group. And lastly, I want to say about the ways forward. It's really high time that it's really high time that the government should really think about building trust with the citizens in between this pandemic. To do so, I think it's important for government to support strong accountability agency like CIA, and the vacant position of constitutional bodies should also be fulfilled without any political bias. Similarly, there is also a clear need for feedback mechanism in communities based on validated information, and the government to take the action, and the government to take action on those feedback mechanism is also really important. And also, most importantly, the government should provide actually the platform for citizens to play a central role in following the money at different levels. So yeah, that's the point that I want to share, and I'm really happy to answer all the questions that you have. Thank you.
Very much for a wonderful presentation, and thanks to all the presenters for staying under 10 minutes or so with your presentations. Now we're going to turn to the Q&A portion of the event. And I wanted to remind everybody that there'll be some poll questions coming out during the Q&A session. Feel free to answer or not answer, as is your preference. Folks have been submitting questions in the chat function. I think we'll have time for more questions if you'd like to type something in. Again, that's how we're gonna handle the Q&A section. I'll read the questions from chat, and then we'll move forward with the questions. So again, I wanted to introduce myself. My name is Frank Brown, and I'm the head of the Anti-Corruption and Governance Center at the Center for International Private Enterprise. This is an event we're putting on regarding corruption and COVID-19 in South Asia. We're doing this with Accountability Lab, an innovative NGO with whom we work in 3 countries, and we've been collaborating for about 6 years. It's headed by Blair Glencorse, and we may hear from him later if there are questions. The presenters today, 2 of them were from Accountability Lab operations in Nepal and Pakistan. A 3rd presenter was from Transparency Maldives, a site partner located in Malé, the capital of the Maldives. So the first question we have, I suppose, is to Fayyaz from Pakistan. The question is, did you observe any community protests in Pakistan? So Fayyaz, that's for you if you want to unmute yourself.
Yes, after this Ahsas, relief package, it started off in Pakistan, which was about, distributing 12,000 rupees to over 12 million families. The cases of corruption, they emerged first in Sindh, where the people who were responsible for distributing this money, they started siphoning off this money altogether, and this is where, communities in Sindh, they protested and they burnt out their national identity cards, which are, their IDs, national IDs, in the protest, that because the government was claiming that, these distribution are happening on the basis of data which is held by National Database and Regulatory Authority, a very credible institution otherwise, but the money was being given to people who were not even registered, or otherwise their socioeconomic statuses did not allow them to sort of receive those monies. So first of such protests happened in Sindh, and then within Sindh we saw few more protests. There was but in early days there were few in front of the office of the Deputy Commissioner in Karachi as well, and then eventually we saw some protests in parts of Punjab, particularly in South Punjab, where there were reports of corruption, and sort of not treating people with who were suffering from COVID-19 in public institutions in Multan district.
Fayaz, thank you very much for that concise readout on the situation in Pakistan. We have another question now from a long-term at first SNIPE employee in Pakistan and the head of our office there, Hamad Siddiqui, and now a consultant with us. And it's been a pleasure in the past to work with Hamad, who's incredibly committed to democratic issues, not only in South Asia, but globally. His question reflects that. Hamad asks, how can civil society organizations help reduce corruption when economies are suffering, when short-term measures are being taken without public consultation? So I'd like to hand that off to Blair. Blair, if you are able to answer, unmute yourself. I'll read the question one more time. From Hamad, how can civil society organizations help reduce corruption when economies are suffering and short-term measures are being taken without public consultation?
Thanks, Frank. And yes, great question from Hamad. I think there's a really, really important role for civil society organizations to play, of course, in pushing for transparency and accountability in the coronavirus response. Organizations like ours and Transparency International, of course, are calling for a lot more transparency in terms of procurement and contracting, such a critical part of all of this. Others that work with the media are, of course, using the press as a way to push governments to ask questions, to launch investigations into all sorts of issues related to corruption and the coronavirus response. Community-led organizations are mobilizing communities and citizens to make sure they're receiving their dues, that their rights are respected, that they are closing feedback loops in communities. Civil society, I think, can play a critical role too in pushing for many of the issues that were pointed out during the conversation, including the independence and the political neutrality of oversight institutions, and can really, I think, at some level play that role of trust building that we talked about at the beginning, trying to support reformers within government where those do exist, help connect the dots between what is working and people doing the right thing, and communities to really be that bridge and help solve the problems that exist. One thing that we're doing at the lab too is really finding creative ways to engage people and help them understand what it is that's happening. For example, we're working with a lot of musicians to put out socially conscious music that focuses on these sorts of issues, a lot of filmmakers who are making films about these kinds of things. So trying to ensure that information is out there in the right ways, in languages and in forms that people understand, so that they can ask the right questions, they can push for accountability, and they can push back against corruption.
Thank you, Blair. That was Blair Glencorse, the head of Accountability Lab based in Islamabad. I've got another question. This could be to any of our presenters. So whoever's first, whoever feels comfortable answering this, please unmute yourself and step up. The question comes from Nikos Passos, a professor of criminology at Northeastern University in Boston here in the US and a longtime site partner. Nikos's question is, are any extremist or criminal groups stepping in and assuming governance roles when the government response is inadequate, as we've seen in Brazil, Italy, and elsewhere? So again, whoever's comfortable answering that question, I'll read it one more time. Are any extremist criminal groups stepping in and assuming governance roles when the government response is inadequate, as we've seen in Brazil, Italy, and elsewhere? So if you'd like to answer that question among the presenters, unmute yourself and have a go at it.
This is Ali. Let me give you a, can you hear me?
Yes, yes, thank you.
Yeah, I mean, this is a broad picture. I'm sure those of our partners and speakers on the ground would be a better situation to respond to. So far, overarchingly, we haven't seen that kind of situation. In Pakistan, previously, we might have seen those, particularly during the earthquake and other situations. But in a sense, what we have seen so far, my understanding throughout the region, there hasn't been any such steps from the militant organization, extremist organization to step up. But as the nature of it is a detriment to this kind of action, but that we should not be we should not stop here, because there would be consequences, there would be implications going forward, and I wouldn't be surprised that if in parts of places, pockets might emerge where there would be non-state actors who would be more important, may play important role or try to play some important role in this kind of situation. That won't be a surprising development going forward.
Dr. Riaz, thank you very much. I'll turn to another question that again could be for any of the presenters. So again, if you feel like you want to answer this, just step up and unmute yourself. So the question is, realistic transparency of the pandemic status within countries requires adequate testing before anything else. How can civil society groups contribute to establishing transparency on the testing supply and reporting regime? So one more time with the question, if you think you have the answer or would like to answer, unmute yourself. The question is, if there's going to be real transparency regarding the status of the pandemic within countries, we need to have adequate testing above everything else. How can civil society groups contribute to establishing transparency on the testing supply and reporting regime? So if you'd like to answer that question, unmute yourself.
Frank, if I can go ahead.
Please, yeah.
Yeah, so in Pakistan's case, it has been one of the worrying trends. People right from the beginning, we suspected that the government was hiding sort of, the real numbers of infected people in the country. So one good thing that we have witnessed is that the National Disaster Management Authority (NDMA), which is responsible for all the emergency response in the country, including this one, they have put up a website, where they are sharing in real time, which public hospitals are receiving what kind of equipment, So that's kind of, a good step in the right direction. However, at the same time, as I shared earlier, availability of the equipment is probably at this stage a secondary problem. The government, for example, willingly and actively, consciously, they have reduced the number of daily tests here in Pakistan, which many of the civil society organizations and opposition parties, we suspect that is a step towards artificially flattening the curve. The good thing is that the clamor by the civil society organization and some of the political parties, it has made its impact, and the government is already on the back foot. It has admitted that the testing has gone down, but that it will be restored in few days. and then the real-time data will be available with the people. So yeah, the government did backtrack, and there were issues of transparency, but given that people have already noticed it, I think the government will not have much room to sort of continue to play around that. Thank you.
Fayaz, thank you very much.
Let me add to it, if I may. This is Ali. That this is Pakistan's experience is not different from what we are witnessing in other parts, and we have heard from Nepal the situation, and definitely in case of Bangladesh there is a serious concern with respect to the number. Initially the testing was so low that there has been artificially depressed numbers, so to speak. Now we are witnessing this is growing, and the number of test sites have been increased. However, how can we actually monitor this one? This is a most important thing that I understand at this point. The civil society organizations such as Transparency International, civil society organizations which have been working in the rural areas, particularly the NGOs tied to the development work and social services, they should actually create a network of their own, which it should already have, and try to press upon the local authorities to ensure that whatever the test equipment they're getting, what is the latest number and how it is being administered, those are the things needs to be on the ground kind of operation. And the civil society organizations do have a network that they can use. Will they be successful 100%? Will there be no opposition from the government? I can assure that's not going to happen. The governments will try to create what Fayaz has rightly described, artificially flattening the number. Yet it is necessary that the civil society organizations and NGOs do participate and create pressure, because otherwise the demand for the transparency won't be there. But it is not only about the testing, it should also be about the funding. Procurement is one part, but also with respect to, as I have mentioned in my presentation, where is the money going, stimulus packages, who is getting it, how it is being distributed. Those sort of things needs to be asked and pressed upon.
Thank you, Dr.
Just one more thing to add there, Frank, as well. This is Blair from Accountability Lab. Is whistleblower protections, which are of course a huge issue in all sorts of countries, and in South Asia, I think generally there's a lot more to do in terms of protecting whistleblowers and really providing rigorous frameworks for whistleblowing, so that anyone at any point who sees any kind of corruption within the procurement of testing equipment or any other part of the response to the coronavirus knows that they will be safe and that they can report that, and something will be done about it. A lot more to say about that, but another key piece, I think, of how we can suggest that governments can better respond to all of this in terms of corruption.
Thank you, Blair. And that's been our experience at site too. If there isn't a robust and trusted whistleblower mechanism, all these measures can be for naught, be quite ineffective. One more question coming in. The question very much speaks to SIPE's work, which largely focuses on engagement with the private sector. The participant asks, what ways or responses have your organizations found to engage the private sector in mitigating corruption? So that question would go to the folks in Pakistan, Nepal, or the Maldives. Again, the question, what ways, responses have your organizations found to engage the private sector in mitigating corruption? So whoever would like to take that, just go ahead and leave your thought. And it may be that it's just too early days that
Can I'd like to contribute. So one of the things that we've found in terms of engaging with the private sector is that everybody is learning from the COVID-19. Everything's happening so fast. The government can't keep up. The private sector largely can't keep up. The civil society is learning. So at the moment, we, for example, at Transparency Maldives, we're working with UNDP and some other private sector organizations that provide legal assistance to try and provide legal assistance to people who are losing their jobs and who are being unfairly dismissed. So that's one of the things that we're trying to do. And we know that some other organizations, civil society organizations included, are trying to bring on civil society organizations such as the technology community to try and build websites, applications that can help, for example, with something as simple as ordering for groceries, food. So things like this are happening, but it's not happening as fast as the spread of the COVID-19, because everything's, the COVID-19 is spreading so fast. All sectors of society, including the private sector, the government, civil society, are having a hard time keeping up. But after the first few months, March and April, we're seeing civil society organizations, private sector, and other sectors of society try and team up to try and find solutions to these issues. This includes transparency motives as well. We're currently working with UNDP, as I said earlier, to try and provide legal assistance to people who are losing jobs.
Thank you, Aiman. That was Aiman Rasheed from the capital of the Maldives, Malé, with Transparency Maldives site partner located there. Quick question for Ashmita in Nepal. And Ashmita, I know you've had some connectivity issues, but I'll go ahead and unmute you, and hopefully you can hear this question. So the question is, in Nepal, remittances are declining rapidly because migrant workers are losing their jobs in the Gulf, Malaysia, and elsewhere. Remittances are such a huge part of the Nepali economy. Do you think this will force people towards corruption as they try to make ends meet?
Yeah, definitely. Like this COVID-19 will have highly impact on remittance, and also like there will be like unemployment level is going to be definitely going to rise up actually in Nepal. Like this time, like this was also like a lesson learned from the earthquake. Government now have decided, like recently Ministry of Labor and Social Security and Foreign Employment has recently started to do some homework around this kind of thing, collecting the information about the returning migrant workers who are like on unemployment right now. And they also have created a self-employment program in new budget, like they have also kept that for that. But we will, I don't know, like who will get this opportunity. This has been recently implemented. If you see the case of Nepal, then the policies come so fast and implementation is really slow. So I don't know like who will get this opportunity and where will the money goes. And I think like corruption will definitely play a big role in this.
Thank you, Ashmita. That's a theme I think we will be seeing come up more and more intensely in the months to come. The massive repatriation of migrant workers and the loss of remittance income. I'd like now to turn to a question from Brooke Horowitz, a London-based anti-corruption expert with whom SIPE has worked for years in Moscow and in Asia now through a UNDP program. So Brooke asks, and this is to everybody, his question is, surveillance technologies, social control, legal enforcement, they've all proved to be successful in some countries in the fight against coronavirus. And they could be used to bring corruption under control as well. How can these technologies be developed legally, not oppressively, to fight corruption? So let me just ask folks to mute themselves. There we go. Okay. And I'll read the question one more time because it's a little complicated, from Brooke Horowitz. He asks, surveillance technology, social control, and legal enforcement that have proved in some countries most successful in the fight against coronavirus could be deployed to bring corruption under control. How can these technologies be developed legally, not oppressively, to fight corruption? That's a question for whoever would like to answer it. Just unmute yourself.
Can I take a go at it?
Please, Dr. Riaz, please.
First of all, the background that has been provided with respect to the use of information technology in controlling. Some of them have been very intrusive. I understand the necessity of using these new technologies, particularly artificial intelligence and others, which China has done extensively. They already had it in place. It's not that they have developed it for public health; it was there. So the surveillance techniques and other things have been used and been used successfully with a very high price. Now, how can we use it positively with respect to the controlling the corruption? I think we'll have to use it from, the low tech should be the first one and going forward. And in this respect, the private sector, if not the private sectors, the civil society organization and organizations like SITE, and of course the anti-corruption, those who are involved in anti-corruption movements such as Transparency International, and all these organizations can come together in tracing and tracking the steps taken by the government. For example, we talked about the procurement issue. If it is procured, it is used. Where it is procured, where it is used. Also with respect to money, right, that we have seen in case of Pakistan, and I mentioned in my introduction, and it came up again, Fayaz mentioned it with respect to how many people are being paid through this project that they have taken the scheme. So yes, there is a possibility, and that is where I am suggesting the leading of the CSOs and organizations like SITE, particularly Accountability Lab and other things that we are talking about. This is where it can be done. Might not be as good or as extensive as the Chinese have done with respect to controlling the virus, but we will have to be careful with respect to not being too much excited about this intrusive technology. Have some reservation as to where should we stop, then where should we go. But this is a good idea, and it can only be done through CSOs. And government can be involved if the government wants to, or the governments wants to. But I am afraid that they won't be, and that's why it is the task of particularly the donors should be taking the lead on this, because they are putting a lot of money. Countries are mortgaging their future. But most importantly, previous occasions we have seen that the traditional anti-corruption policies and mechanisms didn't work out well in this kind of situation. So the leadership should come from the donors. They are the ones who should be protecting the whistleblower thing that I brought up. Whistleblower not only within the organization, the journalist. It has become very common, almost every day in South Asia that we're witnessing, that the journalists are being persecuted or at least silenced for reporting and all sorts of things. So whistleblower protection, transparency, and all these things should be conditioned. And when I say conditioned, I'm not suggesting that they should stop, but they should ensure that donors, CSOs, organizations like Transparency International, organizations like SITE can actually work together to build in different places, whether it's at the smaller level or the national level. That depends. But use of technology is good, but we will have to be careful as to why we're using it.
Thank you, Dr. Riaz.
Frank, if I can add to what Dr. Ali has said, we have some anecdotal evidence here from Pakistan that might be relevant in this case.
Yeah, Fayaz from Pakistan, from Accountability Lab in Pakistan, please go ahead.
Yes, I agree with what Dr. Ali has said, that these technologies need to be basic, so much so that the people could really understand them, that they are being used. And secondly, if government are using those technologies, they need to be open about them. For example, what kind of data is being collected, how often is that collected, and how is that collected? How is it beneficial for the people? They need to be very open about that so that people know that something is being and how it is going to be used. And people from civil society can possibly and potentially educate people that how these information or this data can sort of be used against them as well. In Pakistan's case, some of the colleagues, the government of Punjab and federal government, initially utilized this technology. They tracked all of the COVID-19 patients, with their phone numbers, and then whoever keeping their cell phone with them would come close to them, within a certain distance, they would receive an automatic message that you have been close to a COVID-19 patient. We would suggest you to get yourself tested or quarantine yourself. So that was a very basic technology, and people knew that, since these information were being shared with the people, first and foremost, they knew that that those who are sort of infected, their movement is being tracked. Government knows who they are, and government also knows that who are the people who are being trying to be close with, trying to go close to them. So that kind of transparency in the use of such technologies can be really very helpful. And again, as Blair and Dr. Riaz had said, the trust is the main issue. If the government is transparent enough and willingly, consciously try to build that trust among the people, I think people can. They wouldn't have any objection on the use of that technology. A, it's transparent. B, it's purpose based. It's not secretive. It's not clandestine, and it doesn't sort of impinge upon their basic rights. Thank you.
And those are the information they need to be shared with. If the government is collecting those information, the extent of this information and access to those, some of those information, not to the details, should be shared with the civil society organizations such as Transparency International, such as you, so that it is tracked. The government program is tracked how they are being used. Because I am afraid that given the lack of trust between the citizens and the governments in South Asia, given the authoritarian mindset of many of these countries, and we know what it means, I am afraid whether those would be abused. And we should not simply delivering those information to the government and without any kind of overseeing mechanism.
Thank you, Dr. Riaz. And so on the theme of information sharing, that's one of the things that we are trying to accomplish here at the Center for International Private Enterprise in having these weekly corruption and COVID-19 public events, in having a blog series, which you can find on our website, and establishing a WhatsApp channel on the theme of COVID-19 and corruption. It's all about information sharing. It's all about striking the balance between public health and transparency and privacy and democratic institutions. So if you'd like to take part in those conversations or take part in future events, please put your phone number in the chat section and we'll add you to our WhatsApp channel, or else you can send an email to acgc@sipe.com. So it stands for Anti-Corruption and Governance Center at sipe.com. We have a question now from Abigail Bellows, who's a former US government official and a genuine thought leader when it comes to corruption issues. You can find her publications, including ones about COVID-19, on the Carnegie Endowment for International Peace site. She asks our panelists from Pakistan, Nepal, and the Maldives, she asks them, are you noticing any changes in how civil society collaborates on anti-corruption? In particular, excuse me, during this COVID-19 period, you see more partnerships forming between the elite professionalized NGOs and community-based groups around corruption accountability issues. Or, on the other hand, are grassroots groups becoming even more marginalized during this time? So I'll read that through one more time, but anybody from Pakistan, Nepal, or Maldives who'd like to answer, please unmute yourself. So the question one more time is, are you noticing any changes in how civil society collaborates on anti-corruption? In particular, during the COVID-19 period, do you see more partnerships forming between elite professionalized NGOs and community-based groups around corruption accountability issues? Or, alternatively, are grassroots groups becoming even more marginalized during this time? So whoever would like to take that question, go ahead, unmute yourself.
Hi, I'd like to respond. The Maldives, in the Maldives, the civil society sphere is very underdeveloped. However, we're seeing partnerships between elite organizations, and we're seeing partnerships with individuals and private companies as well, to try and provide, for example, food, clothing, and basic necessities to migrant workers and people in need. I think one of the main themes of the response to COVID-19 from civil society organizations in the Maldives is collaboration, and that is one of the most positive things that we're witnessing in the Maldives. And for the most part, this collaboration is between the civil society organizations based in the capital, and the civil society organizations based in capital tend to be the more professionalized and elite organizations in comparison to the community-based civil society organizations in the islands. So yeah, it's a very positive development in the Maldives, and it's something that we will seek to sort of expand going forward, even beyond the COVID-19 pandemic.
Aiman, thank you very much. That was Aiman Rasheed.
Frank, can I add to this what Aiman has said?
Please do, Fayaz. We have about 10 minutes left. I wanted to get a couple more questions in, but go ahead, Fayaz from Pakistan.
Yeah, we'll just take 30 seconds. You know, when government started locking down cities and then other areas, the grassroots civil society organizations were the first one to respond to this kind of situation. They knew that there are people who are going to be unemployed, families who are going to be without food, and that kind of support. And they were the first one who locally mobilized those resources to start providing those food items and other support items to the communities. However, we have not seen any major local or international big civil society organizations coming forward in this regard. Some businesses have sort of stepped in, and they have facilitated these grassroots organizations to support them with food items. But other than that, the international organizations, their response is still I think they're still reading the situation and probably don't know how to adjust their otherwise very closely locked in programs who might not directly relate to this currently emerging situation. Thank you.
Thank you, Fayaz. That was.
I would also like to add something on this. Can I?
This is Ashmita from Nepal, Accountability.
Yeah, from Nepal.
Yeah, go ahead, Ashmita.
Yeah, so I think there are there are many small groups that they might also raise public voices effectively. So not only every time the grassroots groups are more marginalized, so it's also because of the government willing not to bring CSO in discussion is also one of the reasons. So I think they are not going to be marginalized because there are many other organizations also who are they are raising the voice of those people. So yeah.
Excellent point, Ashmita. So we've got time for one or two more questions. There's a question that anybody could answer, I think, meaning Dr. Riaz, Blair, or the panelists from Nepal, Pakistan, and the Maldives. This is from Ahid, and it touches on a topic that we've really been grappling with internally at site as we decide how to respond to the COVID-19 crisis. So Ahid asks, are there any pushbacks coming from certain communities when CSOs advocate for more transparency and accountability? Is there any kind of narrative going around that this is not the time to talk about transparency and that governments need to be given full control to deal with the pandemic? How could CSOs deal with such a scenario? So that's a question for anybody comfortable answering it. Dr. Riaz, Blair, the participants, the panelists, just go ahead and unmute yourself. So, Dr. Riaz?
Yeah, I mean, we haven't seen that kind of a pushback, to my knowledge, all around the South Asia. That mostly came from the incumbent, and particularly if we are looking at Bangladesh, which I follow very closely, and beyond that as well, as far as I understand, the pushback has, if it has come, it has not come that from the other organizations, civil society or something. It mostly came from the government and mostly came from the groups and the supporters of the incumbent regime. Why? Because they think this is not a moment to quote unquote politicize the issue. This is the argument that we have seen. That's why it is an interesting situation, and I think very positive one too. And this is the moment that the CSOs and organizations like Accountability Lab, TI, and most importantly, I keep on sounding like a broken record, but I think the donor community has a significant role in this, because this is a very unusual circumstances, and we have seen how much money they are asking for understandable reason. I'm not suggesting, but previously all these things have led to widespread corruption. Let us accept the fact. So there is no pushback. This is good. There is no pushback, except part of the government, part of the government support. This is the moment. This is the opportunity they should take, and the donors, the international community, organizations like SIPE, organizations like TI, and the civil society organization in respective countries should come together and keep this pressure, build this alliance for demanding more accountability, because it is public money, it's people's money, whether I'm paying the taxes here, which is going there, or it is being borrowed in the name of the public, whether it's in Pakistan, Nepal, or in Bangladesh.
So Dr. Riaz, I couldn't agree more. And that's, I think, a very active debate here in Washington and other world capitals, where some of the international financial institutions and leading donors are located. Is this the time to attach significant controls to the billions of dollars flowing to those countries that need it more, as a way not only to provide accountability and oversight, but also to strengthen existing anti-corruption efforts? It's a debate that will continue for some time, I think. So with that, we're coming down the home stretch. I think we've gotten through almost all the questions. I want to thank everybody who's asked questions. And there's a sort of a lively debate going on in the chat section if you want to read some of the back and forth there. It's also a place where you can leave your WhatsApp number if you'd like to be placed on the COVID-19 and corruption WhatsApp channel that SIPE is curating, is moderating. I wanted to say thank you to our panelists, some of whom stayed up quite late into the evening, in the Maldives, in Nepal, in Pakistan. Say thank you to Dr. Riaz, who gave a wonderful overview at the beginning of the session. And say thank you also to the SIPE Asia team, including Arya Nijat, Gibson Haynes, who helped facilitate the Maldives section of this, and John Morell, who heads up the department. And also say thank you to the Anti-Corruption and Governance Center team, specifically Ben Schmidt, who put together the wonderful PowerPoint, and Caitlin Newcomb, who's handling the back end of a lot of this and does our Twitter feed. But thanks to everybody who took part. I think I got to all the different questions. There'll be another event next week. Stay tuned to our Twitter feed. You can see the handle there in front of you. Write to us by email if you have questions or would like to be engaged. And we look forward to seeing everybody next week at the same place. Thanks very much. Bye-bye.